Hello friends, myself Dr. Vaishali Vasavda. I welcome you all on my channel. So today we will discuss about boundaries and diameters of pelvis. So this is female pelvis and this is gynecoid pelvis. So here it forms of two innominate bones, sacrum and coccyx. So this whole is one and this is another one. This is two innominate bone. This is sacrum and the down tailbone is the coccyx bone. Then when we talk about joint, it consists of two sacroiliac joints. So here this is sacroiliac joint, right and left side, and sacrococcygeal joint, that is around here between coccyx and sacrum, sacrococcyx joint, and this is symphysis pubis. So anatomically this is of two type. This whole is false pelvis, and after this brim, this is inlet brim, from this portion to this outlet, this whole is true pelvis. So bony, when we talk about bony landmarks from anterior to posterior, so first upper border of symphysis pubis, then pubic crust, then pubic tubercle, then pectineal line, then iliopubic eminence, then back iliopectineal line, then sacroiliac articulation, then anterior border of ala of sacrum, and then sacral promontory. Then false pelvis is formed by iliac portion. This whole is iliac portion. This formed by iliac portion of the innominate bone. Its measurement can predict the size of true pelvis, and boundaries are posteriorly lumbar vertebra and laterally iliac fossa, and anteriorly here some imaginary, you can imagine the anterior abdominal wall. True pelvis is shallow in front, made up of front symphysis pubis around 4 cm. It is deep posterior. It is posteriorly formed of sacrum and the coccyx, and it has inlet, then cavity, and then here this is outlet. Now when we talk about boundaries, so inlet boundaries we already discussed, those landmarks that forms the inlet boundary. Then cavity boundary, that is the above the plane of inlet. So this is plane. ये जो plane है, अगर इसके ऊपर हम imaginary surface अगर place कर दे, that is the plane of inlet, and below the plane of least pelvic dimension. And outlet obstetrics का जो outlet रहता है, like obstetrical outlet and anatomical outlet. So that is above it is bounded by plane of least pelvic dimension and below by anatomical outlet. And anatomical outlet जो है, that is front. Here front is the lower border of symphysis pubis, laterally ischiopubic rami and ischial tuberosity and sacrotuberous ligament, which is not available here but you can imagine, and then posteriorly the tip of coccyx, which is somewhere around here. Then mid pelvis is formed by like plane of greatest pelvic dimension above and below the plane of known mid pelvic plane. Then next come to the diameters, inlet diameters. So inlet की अगर हम बात करें, it has antero-posterior diameter, transverse diameter, and sacrocotyloid diameter and oblique diameters. So antero-posterior diameter जो है उसमें true conjugate or conjugata vera, that is 11 cm, which starts from sacral midpoint of sacral promontory to midpoint of upper border of symphysis pubis, and this is of 11 cm. Then next antero-posterior diameter is obstetric conjugate, that is 10 cm, that starts from midpoint of sacral promontory to the the inner surface of the symphysis pubis, and in that inner surface the most bony prominent part will be there. And then another one is like diagonal conjugate, that also starts from midpoint of sacral promontory to the lower border, inner margin of the lower border of symphysis pubis. Then oblique diameter right and left between sacroiliac joint. This sacroiliac joint, one right and left, to the iliopubic eminence on each side. Somewhere around here you will get the iliopubic eminence. So from here to here, and from right to left there will be oblique diameter from sacroiliac articulation to iliopubic eminence, and this is of 12 centimeter. Then transverse diameter is of 13 centimeter from the farthest point on pelvic brim on iliopectineal line. So this specific portion, from this portion to another opposite side of iliopectineal line to farthest point, and this is of 13 centimeter. Then sacrocortiloid is 9.5 centimeter between midpoint of sacral promontory to iliopubic eminence. So here, somewhere around here it will come iliopubic eminence. So from here to midpoint right side, and here to midpoint left side. Then next is the boundaries of cavity or diameters of cavity. So here cavity is antero-posterior diameter or transverse diameter or oblique diameter, all are equal and is of 12 centimeter. Next is about outlet of this pelvis. So I'll just turn this. So when we see the outlet, so this is the outlet of the pelvis. So here obstetrics outlet, antero-posterior boundaries. So here this is the inferior border of pelvis, pubic symphysis to tip of sacrum. So tip of sacrum will come somewhere around here. So this is the tip. So from tip to inferior border of the center point of the inferior border of the pubic symphysis. Then posterior sagittal, that will be 5 centimeter. So how to imagine posterior sagittal? So you need to, this is bispinous transverse diameter. So here you need to imagine center point. So यहाँ पे आपको mid point imagine करना है. So वहाँ से लेके आपको back side पे जो tip of sacrum है वहाँ तक का जो diameter है, so center से लेके back side tip of sacrum, and this is of 5 centimeter. Transverse is bispinous diameter from one ischial spine to another ischial spine, and this is of 10.5 centimeter. Anatomical outlet जो है, that is it same inferior border of pubis to tip of coccyx, and this is of 11.5 centimeter from here to here, and 13 centimeter when you push this coccyx backward. Then posterior sagittal, here same, the center point of the transverse line between ischial tuberosity of right and left, center point to tip of coccyx, and this is of 8.5 centimeter. And the transverse diameter will be intertuberous diameter, and this is of 11 centimeter. Next is diameters of midpelvis. So anterior-posterior diameter जो है, that will be in inferior border of pubic symphysis, 2 point on the sacrum at which mid-pelvic plane meets. So here this will be from this point to this point, it will be 11.5 centimeter. Posterior sagittal will start from to point at which mid-pelvic plane meets to the center point of transverse line, and this is of 4.5 centimeter. And transverse diameter here will be the bispinous diameter. So from one ischial spine to another ischial spine, and this will be of 10.5 centimeter. Thank you.